We stay on the subject of Tzu Chi's hospitals in our next feature. The Foundation's medical mission has been going for 25 years, and although there are no Tzu Chi hospitals outside Taiwan, there are free clinic centres and dialysis centres in Malaysia, the United States and the Philippines. Tzu Chi also sends emergency medical teams to disaster situations around the world, and in special cases brings patients to Taiwan for complex procedures. Sofian was born in Indonesia in 1989. When he was 7 years old, a tumour started to grow by his right eye. His parents spent all their savings on 2 operations. But the tumour continued to grow, making it impossible for him to close his eye. In his 14th year, Tzu Chi volunteers arranged for him to go to Hualien Tzu Chi Hospital for treatment. A medical team set about saving his vision and restoring his features. On May 13, 2004, doctors and nurses from 8 different departments completed a complex 21-hour procedure. But healthcare at Tzu Chi Hospital is more than just treating the patient and curing the disease.
I'm better now. Thank you, Master Zheng Yan. Thank you, doctors. Thank you, nurses. Thank you, Mommy.
Sofian came to the attention of Tzu Chi because of TIMA, the Tzu Chi International Medical Association, which in turn has its roots in the Rwandan genocide of 1994. During the crisis, Tzu Chi doctors worked on the front line in cooperation with Médecins Sans Frontières. 4 years later, in 1998, TIMA was formed. On March 27, 2006, when Indonesia was rocked by the Java earthquake, TIMA chapters in Singapore, Taiwan and Malaysia sent a 45-member team to treat the wounded. Fixing IV trips to banana trees, the doctors worked under harsh conditions and performed surgeries in an international disaster situation for the first time in TIMA's history. Following the China earthquake of May 12, 2008, 17 TIMA teams rotated in the disaster area. A local hospital was inspired to join the free clinic. After the Haiti earthquake of January 12, 2010, 73 doctors in 8 missions served 15,264 patients. Both patients and doctors were moved to tears. Apart from emergency aid, Tzu Chi also runs healthcare service points. Tzu Chi opened a dialysis center in Penang, Malaysia in 1997. Because of the rich, salty Malaysian diet, over 200,000 people out of a population of 20 million suffer kidney failure, but only 20% can afford treatment. Today there are 3 Tzu Chi dialysis centres in Penang, Butterworth and Jitra that give patients free treatment. In 2005, Tzu Chi launched the Vision Restoration Program in China, helping over 5,000 poor cataract sufferers see again by 2010. TIMA also helped blind people to see again in the Philippines. In war-torn Zamboanga in the Philippines, invalids and cripples are a common sight, but the cost of a prosthesis is what the average family would spend in 6 months. In 2004, TIMA Philippines opened a prosthesis center to help poor disabled people. But pain and disease are not confined to the developing world. In 1993, Tzu Chi established a free clinic center in the United States in the first step to internationalizing its healthcare network. The first free dental clinic took place the following year, in 1994. Later, volunteer doctors used community clinics and the Tzu Chi Mobile Dental Clinic to reach out to more patients. Inventive doctors made their own portable equipment to take on the road. All over the world, expert medical volunteers have served over 160,000 cases in nearly 8,500 free clinics, helping a combined total of nearly 2 million people. Their selfless service is flying the flag for great love.